guest. So without further ado, I want to present to you and introduce to some Miss Janet Larson Meyer. Are you there?
I am, Todd. Thank you so much. And thank you for joining me, ladies and gentlemen, on this forum this evening. We have a very special presentation in store for you. Let's begin by me telling you a little bit about our featured guest. Earlier this year, Dr. Rick Sloan and his wife and business partner, Valerie, were introduced to CTFO by their beautiful friend, Lori Nelson. Dr. Sloan and Valerie are recognized throughout the country for their outstanding success rate in cleaning people up from all demographics suffering with addictions of all kinds. And the beautiful part about these two professionals is they treat the people that live under the bridges here in Phoenix, Arizona with the same loving compassion as they do politicians and CEOs of companies who fly in and take advantage of their unique recovery model. So tonight we'll hear how recently Dr. Sloan added CBD into his care model to help many of his patients, and he's going to share what additional benefits it's brought to his patients, sharing stories to help make his point in just a few minutes. We are in for a very special treat here, ladies and gentlemen, as I introduce to you my new friend, a CTFO business builder, an expert in the field of addiction, and an extraordinary humanitarian. Dr. Sloan, welcome to our webinar.
Thank you, Janet, for that nice introduction.
Absolutely. I'm happy to have you with us. Before we get into our interview, I want to take just a minute to share with our viewers that we're not making any claims of cures here. What we are doing is sharing invaluable information with you tonight and stories coming from a medical expert with no guarantees that others will experience the same results. So now that we get that formality out of the way, let's move on here, Dr. Sloan, because we have a lot of great information to share. Let's start out with you telling us a little bit about yourself, if you would, about your education, your work experience, and your associations, because I really want our guests to know how fortunate we are to have you here with us tonight as an accomplished doctor and an expert in your field.
Well, thanks again. I do appreciate that. So my career basically started in Alamosa, Colorado, where I went to, I was actually in the Navy for 10 years prior to that as an enlisted sailor, and then got out of the Navy and actually went back to college and finished a degree there at Adams State College, and got into medical school at the University of Colorado in Denver. And once I graduated from University of Colorado, I got accepted into the St. Anthony's hospital residency in Denver, and then I transferred to St. Joseph's Hospital in Phoenix and finished my residency there. And at the end of my residency, I became the chief resident for a whole year. After that, I went to the reservation and served some time working with Native Americans in all different aspects, but that's where I got introduced into the field of addiction, and I've been doing it ever since. And I've actually been doing addiction medicine now for since about 2005, so about 13 years. Our clinic is located in Phoenix, Arizona. In the last 15 years, we've probably detoxed 20,000 people off of opiates, and we currently manage about 400 to 600 patients a month, keeping them clean off of drugs and alcohol and things like that.
Wow, that is just amazing. Stories about the opioid epidemic are everywhere, Dr. Sloan, and it's an issue that touches just about everyone. And I bet most of us are related to or know someone who's succumbed to an opioid addiction or another addiction. So thankfully, you're making a big difference for the outrageous number of people who are enslaved to an addiction. And currently, as you said, 20 to 30 patients a day are being treated in your practice called Compassionate Care Centers in Phoenix. So if you'll take just a minute to tell us what makes your clinic so unique with a really almost incomparable track record of success in helping people overcome their struggle with addiction.
Well, first off, I just wanted to, one thing I forgot to mention was that I was asked to be on the Arizona Governor's Substance Abuse Task Force in 2016, where I was able to help at least explain as a physician what our roles are as, getting people clean and getting people off of drugs, and kind of how we do it in our own sense. we have a very interesting way of detoxing people. It's very safe. We've actually detoxed pregnant women off of heroin very successfully, and they've ended up with having beautiful babies. I've detoxed pregnant women off of benzodiazepines, again, very safely. And I don't think anybody in the whole state of Arizona actually even does that, really, especially as an outpatient. And we do everything as an outpatient. But I think the key to us being so successful is our follow-up care. We not only do we detox our patients, but we actually follow up with them in the short days, weeks after, months after, and we keep them in our clinic for an entire year just to kind of keep up with them, give them medication assisted treatment and things like that throughout the whole year. So I think that's kind of key. As an inpatient place, they would detox somebody, discharge them out, and say, go find somebody to help manage your problem, where we kind of do everything. And I think that really is successful. And our numbers are about 96% clean in the first year.
Wow, that is just remarkable. And I know you shared with me, Dr. Sloan, in some of our private conversations, that some of these patients, and I mean many of them, you continue to have relationships with over the course of years.
Yeah, that's very true. In fact, I have patients that, we detoxed clear back in 2006 that still come to my clinic every month or two to follow up. So it's amazing. So our success rate is years and years and years down the road. And there's some people that you just lose you just lose. You don't know where they went, or they don't come back. But for the majority of our patients, they continue coming back. And we even have people that we've detoxed from like Alaska or Iowa or even New York City. And I even detoxed somebody from India, and they actually will call us once every 2 or 3 months and just let us know that they're doing okay.
Oh, that is so amazing. What addiction do you treat most often in your practice, Dr. Sloan, and how big has the problem of substance abuse become in our country today?
Well, I mainly treat opiate addiction. It seems to be the forerunner of problems right now in our country. I will say that benzodiazepines are definitely creeping up there as well, and they're a drug that are really less known, but like the Valiums and the lorazepam and kind of the anti-anxiolytic drugs. But as far as opiates, we do probably 80% of our detoxes are opiates. And just as a statistic, last year, there were 72,000 deaths from opiates in 2017. And that is more than car accidents and all accidents combined in the United States. So it's definitely one of the leading causes of accidental deaths in the United States these days.
Wow. What's the origin of most people's opioid addiction? Like, in particular, is it prescription drugs for a pain condition usually?
That's correct. So I would say much more than 50% of our patients are chronic pain patients that have been put on opiates for long-term use, which I completely disagree with. And others, opiates have a purpose. I don't think that they're really meant to be for chronic pain and be given month after month after month, because our brains, the chemical reactions in our brains kind of change, and then we become dependent on those drugs, meaning if you took the drug away, then the patient is going to have withdrawal symptoms. And it takes a while to get through that. And it's a horrific process getting somebody from, having opiates in their brain and dependency back to having their own endorphins, saturating their brain.
Mm-hmm. How fast does someone go? How fast do they transition, like from a person who's just trying to reduce or eliminate their pain to a person who's flat out addicted to the pain medication now that was prescribed to them by their own doctor?
And that's a very good question. And it's kind of, it has multiple answers, but, everybody's different, and everybody tolerates these medications differently. So, there can be a possibility where somebody could be on an opiate for 4 to 6 months and just stop taking them and not have any withdrawal. But there's another possibility where somebody could be taking the same amount of those medications and stop in a month and have horrid withdrawal from that. And I've seen that before. So it all depends on how your brain responds to these medications and what kind of interactions it has and how the brain actually is hindered by the drug.
What does a detox experience look like, Dr. Sloan, for a person who's been addicted to opioids for years? And I'm really excited to hear about what you found about how our CBD can help with that.
So detoxing, what happens when you abruptly stop opiates, what happens is, well, let's go back to the beginning. So when somebody starts taking opiates chronically, opiates are basically an external form of an endorphin for us. And you can go back the other way and say that our endorphins are actually an endogenous opiate, because they share the same receptor. So opiates and endorphins are very similar that way. So what happens when we have a lot of opiates on board, the limbic system, and that's the part of the brain that's responsible for the fight or flight mechanism. What happens is that mechanism to release epinephrine and norepinephrine gets blocked. So you have this buildup of epinephrine in this part of the brain that can't get out into the brain. So really, we lose our fight or flight response when somebody is dependent on opiates. But what happens when we stop taking these opiates is basically the guard's down, the gate is unlocked, and it opens up wide, and all of a sudden we have all this epinephrine, norepinephrine, and dopamine in our brain. Our brain can't deal with this. It doesn't know what to do with all this norepinephrine. So it starts creating these crazy withdrawal symptoms, and these withdrawal symptoms can be, and they're very, very severe in most cases, but extreme diarrhea, muscle cramps, abdominal pain, back pain, leg pain, restless leg syndrome, incessant yawning, goosebumps. I mean, so if you think about, if you ever had the flu, like the influenza A or influenza B flu, and you magnify that by about 10, that's about what you feel like. And the problem with people coming off of opiates is if they just could take one more pill, they know that all those symptoms will go away. It's like the same thing, cigarette smoking has about the same, nicotine has about the same draw, the same craving for heroin as we do for cigarettes. But with cigarette smoking, you don't have all those really, really negative withdrawal symptoms. And even people without those withdrawal symptoms really have a hard time quitting smoking. So imagine if cigarettes had the same thing where if you stopped smoking, you got sick where you couldn't even leave your house. You'd have a lot more smokers, for sure. So, with that said, what we do is we have found a way to kind of keep the limbic system closed for a bit, and then we increase the withdrawal of the drug. So we're giving a medication that actually goes up into the brain and actually gets the drug out of the brain a little bit faster, but we're keeping all that norepinephrine and epinephrine kind of stored in the limbic system. And then after the drug is completely gone, then we start opening that door very slowly. So you don't have this huge rush of this norepinephrine and epinephrine coming out. So basically, a lot of our patients will come into our clinic feeling pretty rough because they haven't taken opiates in about a day. And by the end of the day, they're feeling really good. We had a patient that came to us, and she was completely almost out of her mind with withdrawal symptoms. And you talked to her. I mean, at the end, I can let you say what she said, but I mean, she was pretty much symptom free for the next 3 days. And that was enough for us to get all the opiates out of her brain. And then we actually, placed a Vivitrol shot in her, which is a injectable naltrexone that actually kind of blocks that receptor for many other opiates, which is invaluable because it takes away craving and things like that.
Yeah, you're bringing up we'll call her our new mutual friend, Lisa. And it was hard to even talk to her and hear her unbelievable suffering. And I really had no level of confidence that she wouldn't cave, and who wouldn't cave under those kind of circumstances. And she had all of those symptoms that you were talking about when she phoned me and was needing some help. And you were so good to let me three-way you into a total stranger at 10 a.m. on a Saturday morning when you were intending to stay home, and you had a conversation, and you just stirred enough hope in her that she was willing to have her son drive her out to your clinic. And just the calm that I heard in her voice as she was returning home and over the next few days was just amazing. I couldn't believe, I've heard of people, Dr. Sloan, helping recover addicts, people with dependencies over time. I've never heard a doctor declare that it's not unusual for you to get people through that unbelievable withdrawal stage in 3 to 5 days. And for this wonderful gal, we'll call her Lisa for the sake of an example here tonight, you were able to get Lisa. She responded well, and in 3 days, she was like a different person.
Yeah, she wasn't. We had a week follow-up with her. She came back in a week after her detox, and I would not have recognized her if I didn't know she was in my room 6. I mean, I saw her name on my schedule, and I walked into the room, but if I would have seen her on the street, I would not even have recognized her. She was a completely different person. Her whole demeanor, her whole skin color, everything was for the better. You know, she had makeup on. She was completely different, and she was very happy. And the first thing she did was gave me just a huge hug, which always gets me, you know, for sure. But it makes me know that I'm doing the right thing, for sure.
Oh, yeah. And you know, she helps make our point here that she was driven into an addiction, getting into pain meds to recover from a severe car accident. And then she relapsed, I think, 3 times. And so she comes to my regenerative medical center here in Tempe to explore the opportunity of possibly getting regenerative injections to help eliminate that pain, at which time she makes the disclosure to me that she has a drug problem. And of course, we can't help a patient in that condition. We need to recover them first. I refer to you, you pick her up, you give her a whole new lease on life. Just all corners of her world are coming into full color and full view. It's just a pleasure. And she came to my center about 2 weeks ago, Doc, with the most beautiful bouquet, and with such gratitude for what we had done together to help her have her fresh start. So really, again, the fact that you're able to make a difference so quickly, and that you and your staff invest so much of yourself in a addict's recovery, not just in the moment, not just till you collect their funds, but over time, really, my hat goes off to you.
Well, thank you very much. It's you know, I love going to work every day. I really do. It's you know, when I can get somebody clean from drugs, it just does something. I think that's my addiction, actually.
That's a good point. I'm sure so. You had shared with me that you don't get to be home for Christmas very often, do you?
I do not. No, I in fact, I think last Christmas was the first Christmas that I was able to get up and stay home for like the last 5 years, because people, our patients want to be clean, and especially through the holidays. They just want to be clean through the holidays because they're seeing family. But you know, our motto in our clinic, and you know, I have a wonderful staff. You will meet them very soon. I have one MA that's been with me for over 16 years, if that would say anything. But I have to just make one phone call, and I have a complete staff at my office, and we're ready to help somebody. Because if somebody makes a decision today that they want to be clean, and we start them on this plan, then we can get them through it. But if we say, you know, it's Friday night, and let's just wait till Monday, that patient could actually have overdosed by then, or changed their mind, or so we have to. And it's my life calling, and it's what I want to do. And I don't regret working on Christmases if I can help save somebody. I don't.
Wow, that is just so intense, Doc. I know you're not an addict, but you have derived some great benefits from CBD. So can we back up and talk a little bit about those unbelievable withdrawals that you just took a few minutes to describe for us? Share with us how introducing CBD into the recovery protocol for some of these addicts, what impact it's had on them. And then if you would, after you do that, share with us why you started taking CBD.
Yeah, sure. So over time, well, you can get a pretty good idea when somebody comes into the clinic, kind of how the detox is going to go. And for a lot of people, they have usually 1 or 2 withdrawal symptoms that are the really bad ones, the ones that they just can't stand. And you know, these medications that we give them, a lot of them will help cure some of those symptoms, and they may not cure it completely. So sometimes patients do have some symptoms in our clinic. But in my research too online, and just reading about, you know, CBD in general, was that a lot of patients were saying, hey, you know, when I was coming off heroin, I took CBD and it really helped. And so there's a lot of anecdotal information out there about that. So me being the kind of pioneer person, this pioneer doctor in Arizona that does this outpatient detox, I said, let's just try and see this. So we started using the 1,500 milligram drops in our detoxes, and I can definitely tell you, of the patients that I think would have probably had symptoms, we're probably knocking out about 80% or more of the symptoms they have left over. So, and I'm talking symptoms of like anxiety, the sleep deprivation, the restless leg, the back pains, the myalgias, the arthralgias, the joint pains and everything. So CBD is really, really helping us help our patients even more. And not only that, then these patients are continuing to order their CBD because it's really, truly helping their pain. And, one thing else too I wanted to talk about a little bit, Janet, was that, sometimes, and I don't know how many people are on this call or if there's any people that are struggling with, pain medication, but I can tell you, and you can look this up and Google it or whatever you want to do, but there's a syndrome out there and it's called opioid-induced hyperalgesia. And when I went to medical school, there was nothing in the books about that. This is stuff that's all relatively new in the last 5-10 years. But what they're knowing now is that if people are on chronic pain medication, that over time your body will become more sensitive to pain. So basically, the opiates are actually turning on you and actually making things a lot worse. We've detoxed people off of opiates, and I'll give you an example here in a minute. But we detox people off these, and their pain actually will go away. Given about 2 months, their brain starts saying, "Hey, there's no opiates in here." That induced hyperalgesia is gone, and their pain levels actually go down. And it's not because the pain's not there; it's just because their tolerance for pain has now gone back up again. So, and it's because of the opiates. It reduces that tolerance for pain. So it's a nasty drug. They're nasty drugs, and that they just shouldn't be used chronically. They really should not. And so I hope I answered your question. Anyway,
I'm so happy to hear how you've introduced that into your clinic. And you're right, you are a pioneer, and you kind of beat to your own drum. And thank God there's people like you. If you would share with us your testimonial, because I know before you introduced it into your practice, you first introduced it into yourself. So you had a pain condition going on, and can you touch on that real quickly and tell us about your pain condition? Tell us, did the CBD oil work for you? And then tell us the test model that you set up for yourself to prove a point.
Okay, so yeah, so back in 1987, I was in the Navy, selling all the 7 C's and things. Anyway, I slipped on a ladder, I fell down, and I actually broke my neck on a ship. And I was on a little destroyer, USS Farragut, DDG-37. And the only medical professional out there was basically a corpsman, which, has about the same academic acumen as like a medical assistant, which is maybe 6 to 8 weeks of training and then more on-the-job training. Well, we had one of these people on board, and he was very young, and he basically kind of gave me this cursory exam on my neck and said, "Hey, you're walking, you can move your neck. Here's some ibuprofen," and just basically told me to suck it up. And so I did, and 3-4 months later, I was out there playing football again and tackled, just because I didn't think there's anything wrong with my neck. Well, a couple years later, my arm started going numb, and I started having this chronic pain issue in my neck. And I always kind of refused these opiates. I didn't want to take them. I kind of lived on ibuprofen. But so make a long story short, I got introduced with CBD for that. So I started using the CBD for that, and also I have a knee problem, so I was using it for that as well. And I was extremely happy to say, as a physician, that wow, my pain is went from a 7 down to a 2 just by taking this CBD twice a day. And I actually started with the 750, and I thought, well, it's doing a little bit. I went to the 1500, and I tell you, it was a game changer for me. I really started feeling the result of it. But then not only that, I started feeling less anxious during the day. I could sleep. I was starting to dream again at night, which I apparently had stopped dreaming years ago for some reason, just not sleeping well. And so that's pretty interesting. So I started doing that, and that's really kind of helped me as far as when I'm talking to my patients. At least it's a personal thing for me. This really does work. It really, really does work. And whether you have anecdotal or case study trials, I'm just saying, for me, this stuff actually really puts a damper on my pain, and it helps me live a better life. There's no doubt.
Oh, I share all those things that you had talked about with you exactly to a T. Pain that went from a 9 to a 3 in a matter of just days, and quieting anxiety, sleeping like a baby. My mom says you didn't sleep like a baby when you were a baby. I mean, and more benefits that I didn't even know to expect. So I share that with you. And then, of course, you probably would never have introduced it into your practice if it didn't first impact you. And I know, Dr. Sloan, when I share with people, different than what's published and all the studies out there, when I tell them the shift that happened in my world and the heightening of the quality of my life quickly, not eventually, that's probably the best closing tool that I have. Can you share with our guest here, please, Dr. Sloan, in order to introduce this into your business model, where your addicts are typically in the court system, in the legal system, oftentimes, you wanted to know how they would test in a UA or a urine analysis test. So set up the test that you had put together for yourself to see if this was something that you could recommend to your addicts, please.
Oh, sure. So, as a physician, I know that if people, are smoking marijuana, the THC is basically built up in the fat cells. And if you're a chronic smoker, then you can have, a positive THC finding in your urine for about 30 days. And Janet knows who I am. So I'm not a skinny person, so I definitely have a lot of fat to put the THC into. So anyway, so basically what I did was I have addiction to food as well. But anyway, so I basically started taking the 1,500 milligram drops twice a day. They were lasting me about a month or so at a time. And I did that for 2 entire months. And then I went ahead and did a urinalysis on myself in my clinic. It tested negative in our cup. And then I sent it to a lab where they actually do a liquid chromatography on my urine to check for THC. And it came back negative. So, and I wasn't taking I was taking this because it was before the other stuff came out.
The ice, before the ice. Mm-hmm.
So this is just a regular CBD 1,500. So I thought, this is the strongest strength that CTFO has. And I did the most sensitive test on me, and it came back negative. So I was very reassured at that point. But I could tell people that, you're not going to have THC in your urine if you use this brand of CBD. If you go to the dispensary and get it, though, believe it or not, they have to sell products that have THC in them. So you will be positive on that.
Oh,
So
that's so interesting.
yeah. So yeah, in Colorado, there's a law, and at a dispensary, anything they sell has to have THC in it, which is really strange. But for some reason, it's the law there, and I'm not sure about Arizona, but I know Colorado for sure. But
yeah, well, these are great stories that we shared about our mom, Lisa, and the difference it's made for you personally, Dr. Sloan, and then the impact it's having on your patients. But there's also another category that I want to talk about, and it's about our four-legged friends. So we have a lot of pet lovers on these webinars each week, and you have a good story about your dog and the benefits that your puppy, not so much a puppy, but your dog derived from CBD treats. So can you touch on that real quickly for us?
yeah, sure. So I remember me saying before that I had tried the 750 and it really wasn't working very well. So I ordered the 1,500 and got it in within a couple of days, and I had a little bit left of about half of a bottle left of the 750. So I was just thinking, my dog, my old, he's 13-year-old miniature poodle, and he just recently in the last couple of years had been having a little bit of struggle with joint pain. I could tell when he'd stand up sometimes he would cry. He's not very active. I just think, man, this dog is either gonna pass away pretty soon, or we got to do something. And I was giving him steroid injections, and he would feel better for a couple of weeks, then he'd go back downhill. Which steroids is not the best thing to be shooting up in your animals. I mean, it provides very good relief, but over time it can do a lot of damage to like the adrenal glands and things like that. So I thought, well, I'm just going to try it on this dog, and I just gave him a tiny bit of a 750, and I'll tell you, within about 2 or 3 days, my 13-year-old miniature poodle was running around the house. I'm talking jumping out the doggy door, running in through the yard, playing with the balls. You know, he has a stuffed animal. He's just humping in the corner like when he used to do when he was like 2 and 3 years old. So, I mean, not only difference for me, but my dog it's crazy. And you know, with dogs and pets and things, I mean, there's no way he could just fake that. I mean, it's, you know, it's definitely, you know, it was amazing to me that happens. And we still give him CBD. We give him the pet chews now every day, but he's just lively. He's running around and completely changed his life, which, you know, us as dog lovers, that's fantastic for us too.
Oh yeah, I always say this, and people give me a hard time about it. I'm not into animals because I don't want something else to clean up or get dog hair on me. But there are so many people who in CTFO whose dogs are just members of their family, like for you and the Sloan family. So I certainly want to thank you, Dr. Sloan, for sharing with us your knowledge and your experience and your confidence in what we're all looking to accomplish here at CTFO, and that's just to help people. So we so appreciate you and everyone like you who dedicate their lives to serving others, and may God continue to bless you and bless your good work, Dr. Sloan.
Well, thank you very much. And it's been a pleasure, you know, coming on with you, and hopefully I didn't put people to sleep. So.
Oh, fascinating from bell to bell. Thank you so much, Doc. To our guests, please get back to the person who invited you on this webinar and say yes to this no risk, no cost opportunity. Order your first product and get on auto ship and start talking to people you know and people you meet. Tell them about the health and financial benefits that they can get from our product and our money-making opportunity here at CTFO. And I challenge you to seize the opportunity to serve someone when you uncover a need. Step into that gap, open your mouth and share your answer that you hold here at CTFO. Tonight you've heard firsthand the difference that you can make one body at a time. Look to your exceptional leadership team here, ladies and gentlemen, to help you get off to a strong start. We're ready and we're willing and able to assist you in achieving your goals here. And the bigger the better. Let's do it together. Thank you to all. That's a wrap for tonight's presentation.